Hi, my name's Gabby. I'm going to be your student nurse today. I'm going to be doing a head-to-toe assessment. It should take about 10 to 20 minutes. Do you have any questions?
No.
All right, can you give me your name and date of birth?
Brecken Christensen, November 20th, 2000.
Do you know where you're at?
Yes, Cox Hospital.
What is today's date?
April 29th, 2021.
Awesome. The patient is alert and oriented ×3. Are you experiencing any pain today?
No.
Do you have any allergies that need to be made aware of?
Nope.
Awesome. Alrighty, the patient is sitting upright comfortably. Their mood is appropriate. They have no lines, tubes, or drains around them. And their hygiene is well kept. Alrighty, now I'm just going to look at your head for a second. Is that alright?
Mm-hmm.
Alright, the head is normal phallic shape. The hair is brown. The hair is evenly distributed. There's no lumps, bruises, or lesions on the head. Alright, I'm going to look at your ears real quick. Alright, the ears are symmetrical bilaterally. There's no drainage and bumps or lesions on them. Now will you please smile for me? And puff your cheeks. Say ah.
Ah.
And raise your eyebrows. Awesome. Okay, now I'm going to check out your eyes, so just look forward. Alright, next side. Alright, now just follow the pen light. Awesome. Now keep following it. Awesome. The pupils are round and reactive to light and they accommodate. Can you please hold down your eyelid? Awesome. The cornea is clear, the sclera is white, the conjunctiva is pink, there is no drainage, and there's no lesions. I'm now going to look in your nose. We first go sniff, and then sniff. Alrighty, there's no patency, there's no flaring of the nostrils, there's no drainage. Now I'm going to look in your mouth real quick. Awesome. So the mucosa is pink and moist. The hygiene is well kept, all teeth are present, the tongue is midline. Now I am going to look at your neck real quick. First I'm just going to palpate your carotid. Awesome, the carotid is strong and regular, 2+. And now the trachea is midline to the body. And I'm going to listen for breweries. No breweries present. I'm now going to check for JVD. Look to the left. And no JVD. Alrighty, now I am going to check your sensories on your face and hands. So I'm going to have you close your eyes, but before that, this is sharp and this is dull.
Okay.
So we'll start on your face.
Sharp. Dull. Sharp.
Alright, the next side.
Sharp. Dull. Sharp.
Alright, now I'm going to do it down your arms.
Sharp. Dull. Sharp. Dull.
Next side.
Sharp. Dull. Sharp. Dull.
Awesome. Your sensory perception is intact on your face and your arms and hands. Now I am going to check your capillary refill. Awesome, it's less than 3 seconds. Now I'm going to check your radial pulse. And then your brachial. your pulses on your radial and your brachial are strong, equal, bilaterally, 2 plus. Now will you please first hold your arms up like this, pull in, and keep it, and now push out. Now grab my fingers and squeeze. The arms and hands strength is 5 out of 5. I'm gonna real quick check for skin trigger. No skin trigger present. Alrighty, now I'm going to listen to your heart. Do you mind if I unbutton?
Nope.
And go on this side. And will you lift your breast for me? And last one. Alrighty. S1 and S2 was heard at each valve. Your heart rate was strong and equal. No murmurs were present. Now I am going to just watch you breathe for a second. Alright, there's no barreling of the chest. The chest expands symmetrically. The patient breathes with no labor. Now I'm going to listen to your respirations. First I'm going to do the front. Every time I place my stethoscope, just take a deep breath for me. Deep breath. Deep breath. Deep breath. Deep breath. Alright, will you lift your breath for me? Deep breath. Deep breath. And now I'm just going to do the outer of the lobes. Deep breath. And deep breath. Alright, now I'm going to listen to the back. I'll just button you up real quick. Alrighty, same thing in the back. Just take deep breaths for me. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. I'm just going to go a little bit under. Here for off. Breath. And deep breath. Alrighty, there was no wheezing or crackling. The patient breathed with no labor present. Are you having any breathing troubles?
No.
Have you had a cough recently?
Nope.
Have you noticed any recent weight changes?
No.
Have you noticed any edema?
No.
Have you noticed any dizziness?
No.
And have you noticed any palpitations?
No.
Okay, I am going to have you lay down for me. Now I'm going to expose your abdomen for a little bit. Alrighty, the skin is lighter on the abdomen than the rest of the body for the race and ethnicity. There's no lesions, scarring, bumps, or bruises present. The abdomen is slightly rounded, and there is no movement besides breathing. I am first going to auscultate for bowel sounds. Bowel sounds were heard in every quadrant. When was your last bowel movement?
Yesterday.
Is that normal for you?
Yes.
When was the last time you voided?
This morning.
Is that a normal pattern for you? Alright, now I'm gonna palpate your abdomen. Let me know if you feel any tenderness.
No.
Alright, no tenderness present. Now will you sit up for me? I am now gonna check your patellar reflex. Just hang your legs and put your arms up here. Thank you. Alright, we're gonna do one more time. Awesome. Patellar reflex intact. Now I am going to just check your sensory on your legs and feet. Do you mind if I take off your shoes and socks?
Yeah. I can.
Alright, I'm just gonna roll up your pants a little bit. Just let me know if it's sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp.
Alright, next leg.
Sharp. Dull. Sharp. Dull. Sharp.
Awesome. Your sensory is intact on your legs and feet. I am now going to check your calf refill on your toes. Calf refill is less than 3 seconds. Now I'm going to check for your pedal pulse. Your pedal pulse is strong bilaterally, equal, and 2+. Alrighty. Now I'm going to check your strength. Will you just push up against my leg? Now pull back. Alright, pull your feet up. And push your feet down. Awesome. Your strength in your legs and your feet is a 5 out of 5. Will you please stand up for me real quick? Alright, first we're gonna put your arms out. Put your arms up. Put your arms sideways. Back. Now just rotate them a little bit. And shoulder shrug. Awesome. Now legs. You're going to put your right leg up. Right leg to the side. Right leg back. And now your left leg. Up. Side and back. Alrighty, will you walk forward normally? And now turn around and walk heel to toe. Alrighty, you can sit down now. The patient moves their arms and legs purposely. Their gait is purposeful, no stumbling. As I was assessing the patient, I was checking her skin, and her skin is warm to touch, dry. Skin color matches ethnicity and race. There was no bumps, lesions, bruising, or scarring present. I also am going to real quick check for edema. No edema present. Alrighty, that is everything I have for you. Do you have any questions?
No.
Alright, thank you. Have a good day.
You too.